We all kind of have this belief, right? That after you've put in decades of hard work, your healthcare and retirement is pretty much covered. But what if I told you that's not just a little misunderstanding? What if it's actually a massive financial trap waiting to spring? Okay, let's get into it. I mean, think about it. You've worked for 40, maybe even 50 years for this. You've done everything you were supposed to do. You weathered market crashes, you dealt with inflation, and you managed to build a nest egg that you can actually be proud of. The finish line is right there, and you have absolutely earned that peace of mind. But what if something is lurking beneath the surface? An invisible drain that's just waiting to start siphoning money from your savings the second you punch that clock for the last time. It's a danger most people just don't see coming until it's way too late. Look at this number, $315,000. Just let that sink in for a second. This is the secret. This is the figure that could completely change what your retirement looks like. It's so important that you get what this really means. Because that, right there, is how much a typical couple turning 65 is expected to need just for medical bills. And here's the kicker, the part that should really get your attention. That massive number doesn't even include the single biggest, most devastating healthcare expense of all, long-term care. So let's pull back the curtain on this whole thing. Understanding this isn't just about being scared of a big number. It's about taking apart a myth, a really common myth that could literally cost you everything you've ever saved. And this quote, it absolutely nails it. This is the heart of the problem. That simple, innocent-sounding phrase, oh, Medicare will cover it, that is the bait in the trap. Today we're going to see exactly why relying on that is so incredibly dangerous for your finances. So why is it a trap? Well, because Medicare isn't the solid steel safety net we all picture. A much better way to think about it is like a sieve, with holes in it, and your retirement savings can just pour right through those holes. Let's start with Medicare Part B. This is the part that covers your regular doctor visits, your outpatient stuff. It's obviously crucial. But here's the thing. It was never, and I mean never, designed to pay for 100% of your care. It has a huge gap built right into the system. And the math is pretty straightforward. Medicare handles 80%, and you're on the hook for the other 20. Now, 20% might not sound like a disaster, but what if you have a $50,000 cancer treatment? Well, that's 10 grand right out of your pocket. And here is the most critical part. There is no annual cap on that 20%. No ceiling. That gap can absolutely decimate your savings. And then you've got the stuff Medicare just flat out says nope to. We're talking about things we all need, like dental care, new glasses, hearing aids. These aren't luxuries, right? This is about your basic quality of life, and paying for them yourself can add up to thousands and thousands of dollars. But wait, it's not just about the gaps in coverage. If you were a diligent saver, if you did everything right, you get to face another hidden cost. I like to call it the success tax, because it really is a penalty for being financially responsible. The official name for it is IRMAA, and basically, if your income in retirement, and that includes your 401k withdrawals, goes over a certain line, the government slaps you with a high income label and adds a big surcharge to your monthly premiums. You're literally being fined for saving too well. And this just lays out the frustrating reality of it all. You and your neighbor get the exact same Medicare coverage, but just because you were a better saver, you could be forced to pay double or even triple what they pay every single month. For many people, it ends up being one of their biggest bills in retirement. But you know what? All of that, the gaps, the success tax, it's all small potatoes compared to the single biggest threat to your entire financial legacy. This is the one that keeps people up at night. This is the nursing home trap. So let me be absolutely crystal clear about this because it's the most important thing you'll hear today. Medicare does not pay for long-term custodial care. That means if you need help getting dressed, if you need to go into assisted living, if you need memory care, you are 100% on your own financially. And what does on your own look like? It looks like this, $120,000. That's the average cost for just 1 year in a private nursing home room. And believe me, that price tag is only going up. This is how multi-million-dollar retirements evaporate. It's called the spend down. First, you burn through all your cash. Then you're forced to sell your stocks and bonds. And when that's gone, you sell the family home. You are legally required to spend down almost every single penny you've worked for your entire life until you're poor enough on paper to finally get government help through Medicaid. Your legacy? Gone. Okay, so that's the threat. It's big, it's real, it's scary. But this isn't about being afraid, it's about being prepared. So let's completely switch gears here and talk about your financial battle plan. How do you actually fight back against all this? It really boils down to three core moves. Number one, you have to be smart about your supplemental coverage. Number two, you need to build a dedicated tax-smart fund, a war chest, just for healthcare. And number three, you have to build a legal moat around your assets to protect them from long-term care costs. So, your first big choice is this: Medicare Advantage or a Medigap plan. And really, it's a classic trade-off between risk and predictability. Advantage plans look great because they have low or even $0 premiums. But the catch is, you're stuck in their network and you could face huge out-of-pocket bills if you get really sick. Medigap costs you more each month, but what you're buying is total peace of mind. It plugs the gaps, your costs are predictable, and you can see any doctor you want. Next up is your war chest, the Health Savings Account, or HSA. Honestly, this is the superhero of retirement accounts. It's the only tool that gives you a triple tax advantage. The money you put in is tax deductible, it grows completely tax-free, and when you take it out for medical bills, it's, you guessed it, 100% tax-free. It's your own personal medical retirement fund to pay for anything from premiums to that 20% gap to the dental work Medicare won't touch. And finally, to beat the nursing home trap, you have to be proactive. Modern hybrid insurance policies are a game changer. They combine life insurance with long-term care benefits. So if you need care, you've got the money. If you don't, your family gets a death benefit. And specialized trusts? They create that legal moat we talked about, separating your home and your investments from your name, so they can't be touched if you need to qualify for Medicaid. Let's wrap this up with this thought. At the end of the day, all this planning, all this strategy, it's about one simple thing. You worked for 4 decades to earn your financial freedom. You simply cannot let a predictable and preventable medical disaster take that freedom away from you. So now you know. You've seen the threats that are hiding in plain sight. You know about the gaps, the taxes, and the traps. So the only real question left is the one right here. Are you actually prepared to defend the retirement that you worked so incredibly hard to build?